Welcome to Freedom Biz Now, the show dedicated to showcasing the best and brightest in business, big and small. Now, welcome the host, founding partner of Freedom Sports and Entertainment and the Freedom Digital Network, from Rock Vox Studios in Rochester, New York, Mark Washoe.
Thank you, Scott, and thank you once again to Rock Vox Studios, and welcome back to another Freedom Biz Now segment. And today we have a special guest. His name is Eric Israel. He is the executive director of the Crohn's and Colitis Foundation here in Western New York, and I'm very privileged to serve as the chapter president on the board. And Eric, thank you so much for joining, and welcome.
Well, thank you very much. I appreciate you having me, Mark.
Yeah. So, look, this health pandemic and crisis that we're all going through, unfortunately, is, been hard on a lot of businesses and a lot of entities, and nonprofits and foundations are no different. And maybe in some manner, it's been even more difficult. So, if I may ask, we'll start with kind of what's the Crohn's and Colitis Foundation trying to do at this time in order to kind of get through what we're going through. And again, I know it's been very difficult so far on the Crohn's and Colitis Foundation.
Yeah, so it has been difficult. I mean, clearly it's difficult for everybody, right? But on the nonprofit side of the world, we had 95 events that were supposed to take place this spring alone that represented for the foundation nationally about $15.5 million. So when we look at that kind of impact on our $80 million budget nationally, that's a big swing that we have to try to navigate. How do we deal with those? Those 95 events, some of them have been canceled, some have been postponed into the fall, hoping that we can do, some things in the fall and the pandemic sort of lessens and people can get out again and start congregating. And then some of our events this spring are even going virtual. So we're trying, jumping on the whole virtual bandwagon to try to do some of our fundraising events virtually so that our communities can still get together safely from home, but still enjoy some of those walk-like experiences that they would have this spring. And then in addition to that, sorry, go ahead, Mark.
No, go ahead. Finish. You can finish the thought. Yep.
I was going to say, and then in addition to that, we've got all of our online resources that we're putting together really and changing every day as sort of the situation changes in local communities, with access to payment resources for folks that may need them in order to stay on their medications. Or, hey, with this pandemic, am I at a higher risk of getting it because of the medications that I'm on? What should I do about going to see my doctor or getting my infusions? Or when, let's face it, a patient that's got Crohn's or ulcerative colitis tends to go to the bathroom a lot. One of the things that are in short supply is toilet paper. What do I do if I'm a patient and all of a sudden I find I don't have toilet paper anymore?
Yeah. And I think that's an important messaging point, is that it's already a health crisis going on, and then, everybody's concerned about going to the hospitals where the disease might be spreading. But then if you're a Crohn's and colitis patient, a lot of times you have no choice. You have to go to the hospital if you're getting one of the Remicade type of treatments or other treatments. You might have a flare up, and, that might be a time when you might want to go, and some folks might be afraid of going, and there's in-home infusions and things like that. So a foundation like Crohn's and Colitis Foundation it's really important. In many ways, you guys are a charity of the pandemic, in the sense that you continue to serve also an at-risk population as well.
Absolutely. When we look at just the increased use in our services, there was a 5-fold increase in traffic to our website, a 10-fold increase in online education resources that we have. We have an online and telephone IBD help center that's seen a huge increase in, sort of incoming inquiries for folks that are trying to figure out how they navigate as patients. Because you're right, so many patients are on medications that require them to go to the hospital to get their infusion, or an infusion clinic where they're still in relatively close contact with folks. When you drive down, the expressway, you see signs that say stay home. And unfortunately, these patients don't often have a choice unless they go to a home infusion type product.
Yeah, and I do know that the home infusion, a lot of organizations were starting to go in that direction anyway. And I think in some ways this has escalated home infusions. I know that the Crohn's and Colitis Foundation is also kind of, you're trying to help facilitate and expedite those things, I guess, for patients that maybe, don't want to go to the hospital during this time. Is that accurate to say as well?
Well, we try to facilitate sort of advocacy for patients on many levels, and sometimes in-home infusions is not the best treatment for patients, and sometimes it is. So it's really where we land on all of this is advocating for patients to get them the best possible therapies and the best outcomes for them. Ultimately the goal for the foundation are cures for patients so that nobody has to deal with this anymore. But the reality is we have to deal now with how do we treat patients right now today, and how do we improve their quality of life?
Yeah, no, understood. And so just backing up just for a moment back to what you had mentioned about some of the events going virtual. I know one of the big signature events every year is the Take Steps for Crohn's and Colitis Walk. I've been fortunate to be part of 2 of those now here in the Rochester market. One we did down at the soccer stadium, and the other out at Ontario Beach Park. And those are going virtual now. So when is the official date for the Rochester Take Steps event? And, even though this year it's going to be a virtual and online experience, some could argue maybe a walk you could execute with social distancing and people wearing masks. So are you having, in addition to trying to execute these virtual events really well, is there some discussion about maybe trying to bring some of the live events back? But so before I forget, mention the date and time of the virtual walk.
Yep. So we're actually participating not just as the Rochester Take Steps walk this year, but it's the Rochester Take Steps plus virtual. What that really means now is we have 54 walks across the country that are all going to participate at the same time on the same day. So that instead of it just being the local group of folks from Rochester, it's now folks from 54 different markets that are going to walk together. So we have a huge opportunity to expand the exposure of folks when they come to walk, to see that they're really not just alone. And the 500 or 600 people in Rochester that come to walk really are thousands of people across the country that attend walk. So that virtual walk is going to be on Saturday, June 20 at noon. It's going to start, and we're still working on all the fine details, but we're excited because it's a huge opportunity for us to bring in sort of national level folks to speak. So we've got some exciting MCs that are going to come, some sort of entertainment we're going to do, as well as interactivity with patients from across the country, with the foundation and with each other. Yeah. And then in answer to your question about a local event, we can do a local walk per se. The problem obviously is the parks are closed at this point. So gathering 600 people in the park, even with social distancing, is a little problematic. So our plan is not to do an actual walk in and of itself now, but to wait until things ease up a little bit and then do a celebratory party at some point later this year when it's safe to get away with that.
Okay. And I know another event, and it kind of started gaining popularity in the last year or 2 as well, and before this health crisis kind of hit, was your Spin for Crohn's and Colitis event. We did host one here in Rochester last fall, winter timeframe. What's happening with the Spin for Crohn's and Colitis events as well?
So we have not just the one that we've done in Buffalo for the last couple of years, but we're bringing back the Rochester event. We're looking at Saturday, November 14. The hope at this point is still to be able to do that as an in-person event. We are, still sort of exploring what options we may have should the pandemic continue that long, and fingers crossed it doesn't get to there. But, the hope is that we're going to be able to do that one live. Registration is open for that as well. We've got an in-person walk in Buffalo that's going to go off this September, assuming things sort of trend the way we're hoping they're going to, so that we're still going to have other in-person events yet this year.
Okay. And what other messaging is the Crohn's and Colitis Foundation trying to kind of put into the community at this time? Again, whether it's for the patients, whether it's for caregivers, or just the community at large, what other messaging are you all trying to get across in the midst of everything that's happening?
It really comes down to, for us, that we're still here fighting for patients every single day. So, I've worked from home, thankfully, since I started with the foundation many years ago. So when I get up every morning, it's still going back to the same desk and doing the same things for patients all across the Western and Central New York area. we've changed sort of the way we're doing that a little bit and going to virtual walk, where all of our support groups are now virtual, so that all of those patients that are used to going to a support group can still get those connectivity with other patients and caregivers in a virtual format now. So we're trying as best we can to navigate this virtual society that we're now trying to live in, while still offering patients all of the things that they need.
Okay, and maybe we should have started with this one instead of a little further along the discussion. But we always have this conversation when we're talking about how do we engage with the community and raise awareness for Crohn's and colitis, because there's still some misconception or not a lot of understanding unless you've been directly affected or you have a family member that has, and everybody kind of understands what cancer might be, for example, and. So what is it about, what do you want to convey about this disease and how it's affecting people? And, sadly, this one's affecting a pediatric population, probably more so growing than any of these, long-term diseases that are out there. So what can you just say about Crohn's and colitis in general?
Sure. Well, that's a really good point. We probably should have started there, because it is a disease. They are diseases, rather, that people don't generally understand. There are 3.1 million Americans that live with IBD every single day. Pandemic or not, those patients exist, and they have existed. IBD really is a generic term for Crohn's disease and ulcerative colitis. So it sort of collects those two pieces together. Those two diseases collectively really ultimately are describing ulceration somewhere in the gastrointestinal tract. So, Crohn's disease is starts anywhere from the mouth all the way to the end of the digestive tract, where ulcerative colitis is confined generally to the colon. Now, that, without getting too sciencey and too graphic in this, what that ultimately means for patients is that many of them live with severe pain, inability to eat normal foods. They can't go out in public because they're running to the bathroom on a regular basis. There's all kinds of complications that go along with this. And you're right. Pediatric patients is one of the fastest growing populations for us. We had 90,000 roughly new cases diagnosed just last year alone that we know about. And the problem with IBD is that nobody wants to talk about it. It's not a disease that you casually bring up in a conversation of, oh, I have this disease that causes me to go to the bathroom all the time, and it's really painful, and, I can't do all the things that you can do. There's no badge of honor, if you will, for saying you have this disease. And many people are afraid to talk about it because it's not polite dinner conversation.
Yeah, no, it's a good point. And then, there's other things like fatigue, chronic headaches, just weakness in general. And then the treatments themselves. I mean, we had talked about earlier, every 8 weeks, you have to go to the hospital for infusion, or it's an in-home infusion. Those things are not fun for patients. Humira is another treatment where it's every 2 weeks, it's an injection, and
Yep.
So I think these are things that aren't out there as much as, to your point, as some of the other, more prevalent, I guess, diseases that get more, attention and, publicity overall, I suppose. Like the NFL has their, Cancer Awareness Month, and, where everybody's wearing pink. So, and, Crohn's and Colitis Foundation, we don't get as much recognition. So that's why I think even just, brief discussions like today, especially in the midst of what we're going through, are really important, so that whatever audience we can reach through our social channels and what have you, know that you guys are still actively out there, you're advocating for your patients, and that you're still out there saying, hey, we need help, just like everybody else, so we can continue to do the great work that the foundation's doing.
Absolutely. And there's so many other treatment options out there that patients are dealing with, fun ones like steroids. There are patients I talk to on a regular basis that have been on steroids for 20 years. And, that's not a medication anybody wants to be on, but for, decades, that was the only medication that existed. So our research, we are the largest leading funder of IBD research outside of the National Institute of Health. And, we advocate on a regular basis for new treatment options so that we get to better quality of life for patients, so they're not tied to an infusion clinic or tied to steroids on a regular basis.
Yeah. And actually, one other point that we've missed, and this one's more in the kind of fun category, I suppose, but again, going back to pediatrics and kids, every summer there's a program called Camp Oasis, which are camps throughout the country where kids that have Crohn's disease get to go and connect with their friends and connect with people their age group that are going through the same thing. Because a lot of times it's also a lonely disease, because there might be only 1 or 2, 3 kids in any school that maybe has this disease. So that Camp Oasis experience where they get to go around, hundreds of other kids that have the same thing. And unfortunately, most of those have been canceled or postponed. They're going to go virtual, which will be nice that they can all see each other. But it's another Camp Oasis, another great program that the foundation puts on every year as well.
Yeah, we have 8 camps across the country that we operate, which bring in roughly 1,500 or 1,600 kids a summer to experience summer camp. And many of them, it's the only summer camp they've ever experienced, because with their health issues, they can't go to other places. And it's only for IBD patients. So it's, they're with their peers. And, you mentioned friends, and it's not just their friends. It's people that get what they're going through. One of my peers and I had a conversation about camp last week, and she said there was a young lady that she encouraged to go to camp who didn't want to go. Mom and dad had to convince her to go. She went to camp. She's now graduating college as a senior and still living with the young lady she met the first time she went to camp when she was 10.
That's awesome. That's awesome. And
so they become lifelong friends and support networks for one another that way too.
Yeah, they really do. And now the good news is today with social media and Instagram and Snapchat and all that, the kids can stay connected to each other, even though they might be separated by distance, just like we're all living in the virtual world, present moment. So, Eric, exactly. As we just kind of wrap, we wanted to check in, just, brief couple of minutes today, and anything else you want to convey or put messaging out there, again, into the community as we kind of close the conversation?
Yeah, I mean, the biggest thing, I guess, is a plea for support, and that everything we do, we're doing for the community to try to, increase awareness for patients, as well as, funding for research so that patients have more opportunities for better treatments. We have this phenomenal opportunity through the national office. A very generous donor gave us $1 million match opportunity and said that if we can raise $1 million nationally as a foundation, they will give us $1 million for education programs. So anything any folks can do between now and Friday the 15th that help us get that match would be amazing. They can donate right to the chapter. They can, donate to your walk page, because you've got a walk page, set up, Mark, that people can donate directly to there, or form their own team to come out to our virtual walk and really interact with the community at large.
Yeah, no, great points. And, granted, this is a challenging economic time for lots and lots of people. On the flip side, some people are in a position where they can maybe do something, and even simple things like liking and sharing and retweeting and reposting, even this type of conversation greatly helps. And, even $5, $10, $20 helps the cause, right? So it's almost kind of like whatever you can do. And if you're in a position where you can even write the bigger ones, that's even better. But those are, I think, important messages as well. It's almost like whatever you can do.
Every dollar counts at this point. Yeah. There was actually a study that just came out last week about philanthropic giving, and 4 out of 5 people are still planning on maintaining their level of philanthropic giving that they did last year. So even though we talk about how challenging the economic times are, people are still looking for causes to get behind that they support. So anything folks can do to share the messaging that we have just helps us increase our opportunity of finding those folks that are affected by these diseases and need our support.
Great. Well, Eric, thank you so much for your time today. Thank you for your leadership and your hard work and dedication for the whole chapter and the foundation as a whole for Crohn's and colitis. And just hope you stay safe and well, like all of us are hoping. And then, we appreciate and keep up the good work on behalf of the organization.
Thanks, Mark. I appreciate the time today.
All right. Take care. Thank you.
All right. Bye-bye.
Today's episode of Freedom Biz Now is brought to you by Freedom X Sanitizer. Alcohol-free and water-based, Freedom X Sanitizer is lab-proven to obliterate coronavirus. Find out more at freedomxsanitizer.com.